have some properties. You must know why you must know in order to know how to handling. The first one, it's a setting time. The second, it is setting of expansion. The third one is strength. Number 4, hardness and abrasion resistance. And the last one, detail reproduction. The first one, we have setting time. What is the setting time? By the definition, it's the time elapsing from the beginning of mixing till the material will become hard, which is called the setting time. يعني الوقت من البداية till the material reach to hardness. All of them we will call setting time. While we have mixing time, it's the time from the addition of the powder to water until the mixing is complete. While the working time, from its name, it's the time available to prepare a workable mix. Yani the working time, it means after removing the material from the rubber bowl to the tray, and after that deliver to the patient's mouth. All of this time we will call working time. Generally, it is 3 minutes. Is that clear, please? Anyone? Do you have any question till now? I'm ready.
No, Dr. Easy.
Okay. We have initial setting time and the final setting time. Initial setting time is the reaction proceeds. More hemihydrate crystal react to form a new crystal, which is called dihydrate crystal. It's more complex than hemihydrate. The viscosity of the mass is increased and can not longer be poured. The material will become rigid, but not hard. That means it is an initial setting time. The material can be carved by the carver, but not molded. While the final setting time, it's a time at which the material can be separated from the impression without fracture. That means you have final setting time. How you measure the setting time? You have some way, some method in order to know how you gain the setting, how you reach the final or the initial setting time. You have some tests. Number 1, loss of gloss method. As the reaction will continue, the gloss disappears from the surface of the plaster. It means we have reached the initial setting time. While the second one, it is exothermic reaction. The temperature will be increased. From here, the cast will deliver the hot reaction from inside to the outside. When you put your finger into the cast, you feel about the hot reaction. That means you reach the setting time. You have penetrating test. We have an instrument equipment we call Vicat penetrometer. Use it in order to know about the initial setting time. What's the Vicat apparatus? This is the Vicat apparatus. Consists of a rod weighing 300 grams with a needle of 1 mm diameter. This is 1 mm in diameter and about 300 grams the weight of the rod. Okay. Bring the impression or cast here and apply the pressure. Okay. If the instrument penetrate to the if the instrument penetrates the cast, that means we don't have to reach the setting time. But if you apply this instrument and not penetrate to the cast, it means you reach the final setting time. You have some factors affecting the setting time: mixing and spatulation time and rate. Both of them affect the setting time. Within the limit, the longer and faster the plaster is mixed, the faster it will set, because nucleus of crystallization are broken and well distributed within the mass and start new centers. When you mix the plaster, dental plaster, by increasing your speed, what will happen? The nucleus in the crystals will be broken. When it is broken, it will distribute it and start new nucleus. By the way, with increase the mixing, the setting time will decrease. Water powder ratio: more water used for mixing, the setting time will be increased, but it will affect the properties of the material. Temperature: increasing the temperature 20 to 37, it will decrease the setting time. While, however, it increased the temperature over 37, the reaction will decrease. While at 100, there's no reaction between hemihydrate and dihydrate, and the gypsum will not set. You have some modifiers affect the setting time. You have accelerator. If it's inserted to the gypsum, it will accelerate the setting time, and vice versa. We have retarder. It will decrease the setting time. As we talked, we have some materials act as an accelerator, like what? Salt, like sodium sulfate, potassium sulfate, sodium chloride. They act by making the hemihydrate more soluble, while we have some retarders, like what? Acetate, borate, citrate, borax, colloid, gelatin, glue, agar, coagulated blood. That's why just look at here. If coagulated blood attached to the cast or impression material, it will retard the setting time. That's why you must clean the impression before pouring. Till here it's clear.
دكتور بس آخر مقطع ممكن تعيدها؟
أي واحد مال coagulated blood.
أي بالضبط.
When you take impression to the patient, sometimes the particles of the blood in the prepared area will transfer from the mouth to the impression. Clear?
Yes, دكتور.
Okay. The remnant of the blood, it will retard the setting time of the impression. That's why you must clean the impression by the water in order to remove the remnant of the blood and saliva. Clear?
Yes, دكتور. Thanks.
تمام. باي بس. يلا سلام. Number 2, you have setting expansion. Setting expansion, we have two types. Normal setting expansion is about 0.05 to 0.5%. By the way, all the gypsum products show small expansion during setting due to the outward growing of the crystal during setting. And during normal expansion, only the outward movement of the crystalline will occur. This expansion will be useful and dangerous. If in case of dental plaster, result in accurate cast and occlusion, while in desired case, in investments of material of the chrome cobalt, it will useful. How you control the setting expansion? Increase the spatulation, it will increase the setting expansion, and vice versa. When you increase the water, reduce the setting expansion. Modifier usually reduce the setting expansion, like what? Potassium sulfate, sodium chloride. The second one, we have hygroscopic setting expansion. According to this theory, additions of the water during setting to the gypsum increase the surface film thickness on the inert particle and the gypsum crystal. According to this theory, the inner side of the crystals, it will change and increase in the weight and pushing to each other in order to produce a huge expansion. The importance of it used to expand some investment during construction of the chrome cobalt. The number 3, you have strength. The strength of the material will increase from the initial setting time. You have some factors, it will affect the strength of the gypsum product. Factor affecting the strength. We have free water content, excess water, and we have wet strength and dry strength. The free water content, you must remove it by evaporation. After pouring, we have wet strength. but it is weak. It will tell us it's an initial setting time, while after 24 hours, the dry strength will produce. It is 2 or more times greater than the wet strength. Okay, if you have a dry cast, insert into the water in order to produce the wet cast, and vice versa. The second one, we have temperature. The fourth one, the 5 water powder ratio, and number 6 spatulation. The last one, addition of accelerator and retarder. Both of them, it will reduce the strength. We have tensile strength. Tensile strength, as we know, it is 2 forces directly or to each other. Anyone know about it? Directed away from each other. Gypsum, it's a brittle material, as we know. It is weaker in tension than in compression. The tensile strength of dental stone, it's 2 times better than dental plaster. The importance of it, the cast can cause fracture during removing from the impression. Which time we can remove the cast from the impression? It is not allowed to you remove the cast as soon as possible, because it will not reach to the full strength. Technically, you must remove the cast from the impression after 45 to 60 minutes. Hardness and abrasion resistance. Okay, as increase the compressive strength, the hardness will be increased. After final setting, the surface hardness remains practically constant until most of excess water is dried. After it increases. By the way, the hardness increases at a faster rate than compressive strength. The surface of the hardening mass reaches a dry state earlier than inner portion of the mass. Okay, and outside of the gypsum particle will become dried before inner side. The flow of the gypsum will increase by increased amount of water, but when you increase the amount of water, some of the properties of the gypsum will be disappear or decrease. For producing mobility of the gypsum without disadvantage, we can put the impression on the vibrator in order to mix and flow the material uniformly. Number 5, detail reproduction. Gypsum products reproduce till immediately oral tissue. Type 1 and 2 reproduce 75 micrometer in this, while type 50 micrometer in this. That's why type 1 and 2 it's weaker. And we have manipulation of the gypsum. As we know, everyone know about it. Before starting, bring the rubber bowl. The powder is added and allowed to settle into the water for about 30 seconds. You have 3 methods to mixing, either by using spatula or hand mechanical spatula or power-driven mechanical spatulator. This is the mixing bowl and spatula. And this is the power-driven mechanical spatulator. Infection control. Everyone know about the impression material. It must be disinfected because it's directly associated with the oral flora. That is why you must immerse the cast in disinfection solution, or sometimes some company addition of disinfectant into the stone. The last step, night gas sterilization while treating. And thank you very much. I'm ready to answer your question. Malak, Ahmed,
طلع دكتور.
نعم دكتور.
مفهومة؟
نعم مفهومة.
نعم دكتور مفهوم.
تمام. Your lecture is available to classroom. You can download it.
Okay, thank you.
Thank you. Bye. See you.